So what does this imply for our practice of dentistry in the human population where people expect to have their teeth fixed and maintained, and where our sworn mission is to treat and keep teeth? Are we compromising everyone's or anyone's health with our current methods of treating dental disease? Is there a segment of the population that is especially susceptible to the toxic exposure that we know can be present? Anybody can recognize overt treatment failures, but the problem is especially vexing when we're faced with asymptomatic root canals and painless and apparently healed extraction sites. If it is not an overt failure, we have no way to test if these treatments are a significant stress on the patient's health. As well, we have no test to measure if they are healed to within the patient's threshold of tolerance. Some dentists take the position that no root canal treatments can possibly be healthy and that any detectable ischemic site is a toxic cavitation. Their clientele tends to consist of patients with medically unresolved systemic health problems who are looking outside of traditional medicine for help. Dr. Hal Huggins and his followers have developed a treatment concept referred to as the complete dental revision. They employ all of the concepts of biological dentistry that we have discussed and more to get rid of all identifiable sources of toxicity and stress in the mouth. A criticism of this approach has been that such comprehensive removal of teeth and curettage of bone can leave a patient with such little jaw structure that few dental reconstruction options remain. No one has published a comprehensive review of the outcomes of these complete revision cases. There are a great many patients who credit their health recoveries to their dental revisions. There are also those who did not get relief from their health problems with dental revisions.
Meanwhile, new research continues to confirm the long-debated connection between the health of the mouth and the rest of the body, and this is highly pertinent to root canals. For example, a study published in February 2019 linked root canal infections with increased inflammation and a moderate to high cardiovascular risk. The source for this is M. Garrido et al., Elevated Systemic Inflammatory Burden and Cardiovascular Risk in Young Adults with Endodontic Apical Lesions, Journal of Endodontics, 2019. A second study in the same peer-reviewed Journal of Endodontics also reported associations between infections around the end of the root of the tooth and cardiovascular diseases. The source for this is M. Messing et al., Investigating Potential Correlations Between Endodontic Pathology and Cardiovascular Diseases Using Epidemiological and Genetic Approaches, Journal of Endodontics, 2019. These papers add to the growing body of research over the past 2 decades that supports concerns about chronic inflammation and residual infections around and inside the non-vital teeth being associated with increased risks of health problems. Especially in light of all this compelling research, it should also be remembered that the goal of endodontic therapy, or root canal therapy, is to prevent and/or treat infections of these structures. Endodontist and IAOMT member Valerie Cantor has explained, quote, "We need more research that would more clearly delineate which root canals are a burden of the body and which ones are coexisting without negative impact. Many factors have been associated with the effectiveness of endodontic treatment, such as the use of dental dams, surgical operating microscopes, periodontal condition, and the quality of the final restoration," end quote. Dr. Cantor actively researches newer technologies that are being used to improve the standard of care for root canal treatments. She believes that a new paradigm in endodontics is overdue. In Dr. Cantor's opinion, the use of a microscope, CBCT, advanced irrigation and disinfection techniques, and pre-op and post-op biological monitoring, that is, HSCRP, various cytokines, fibrinogen, and more, should be the new standard of care. Dr. Cantor also believes that patients should seek care from qualified specialists that use advanced 3D debridement and disinfection protocols. Clearly, within the IAOMT, there are varying opinions on root canal treatment. Some of our members do not perform them at all, and some of our members occasionally perform them, and some of our members routinely perform them. Meanwhile, the following statement written in a status report by IAOMT in 2001 still rings true. The IAOMT cannot take the position that all non-vital teeth must be extracted. On the other hand, it is clear that non-vital teeth, with or without endodontic therapy, can present a systemic health risk to some patients. Each patient must be evaluated on an individual basis, considering the medical status and other factors. The IAOMT encourages the dental, medical, and scientific communities to address this area with vigor. Efforts must be made to provide valid methods of determining the systemic health risk from non-vital teeth and provide techniques of endodontic therapy that eliminate or at least reduce the risk.